Hi, good morning. I hope everyone can see my slides and hear me fine. So thank you for the organizers for the opportunity to record the progress we have using the zebrafish as a animal model system to study Diamond-Blackfan anemia. And today I'm gonna focus on my talk on our mechanistic studies on the disease entitled A Calmodulin Inhibition Rescues Erythropoiesis in Diamond-Blackfan Anemia by modulating P53. So this story has been accepted to publish in Science Translational Medicine recently. So, and also I will provide a summary of our ongoing clinical trial and our effort to find better compounds to treat the disease. Wow. So Diamond-Blackfan anemia is an inherited blood disorder that happens in 7 in a million live births, and the diagnosis also mostly happens in the first year of life. And this disease does show affects several systems, including face and hands. And but today we are focusing on the inherited form of anemia, which lacks a production of erythroid cells. So the treatment options currently for DBA includes steroid transfusion and stem cell transplantation. All this treatment has severe complications and also is basically is incredibly important for us to look for better and safer therapeutics for DBA patient. So previously we have described zebrafish mutant with RPS29 mutation, which has a hemoglobin defect that can be rescued by loss of P53. And in fact, about 80% of DBA patients, their molecular defect has been identified. Most of their defects are attributed to ribosome proteins. And so currently known, there are 21 ribosome proteins and 2 non-ribosome proteins affected identified in DBA patients. So basically this, our ribosome protein mutant zebrafish research has a broad implications in study DBA. So this story, so we sort of begin the research by looking at sort of try to find compounds which can rescue the complex phenotype in the zebrafish RPS29 mutant, including the vascular defect and increased apoptosis in the head. So through high-throughput screening of 600 bioactive compounds, we were able to find Calmodulin inhibitors which can revert these phenotype, including the vascular phenotype and also the head morphology. To note that only one of the compounds, the A-3, can rescue the head morphology. The other compounds cannot, so we don't know exactly why. And also the Calmodulin inhibitors has actually 2 classes. One is naphthalene sulfonamides and also the phenothiazines. So both classes of Calmodulin inhibitors can rescue the phenotype. This rescue also evident in the hemoglobin level rescue by the compounds. So it is known the gamma irradiation also upregulates P53 and cause the pause of cell proliferation. So we were interested to examine whether the Calmodulin inhibitors can rescue this cell proliferation arrest. So it is actually true. These compounds can actually partially rescue the cell proliferation in vivo in zebrafish in the RPS29 mutant, in the wild type the zebrafish mutant after gamma irradiation. So by examining the expression of P53 downstream targets, transcriptional downstream targets, it also shows the Calmodulin inhibitors was able to reduce the upregulation of P53 activity. So next, we want to find out whether this regulation holds true in the human cells. So first, we use the A549 cells with RPS19 shRNA knockdown model. So we were able to show the Calmodulin inhibitors was able to reduce the P53 protein level as well as its downstream targeted gene level. Because of the TFP is the FDA-approved antipsychotics drugs and has a long clinical application history with favorable safety. So we basically focus all our downstream analysis using TFP. So the next we ask whether the P53 modulation also holds true in human blood cells. So we use the human sort of CD34 plus cells system to test this. Then we were able to show the P53 targeted gene P21 was able to be regulated by TFP in a dose-dependent manner, and also its protein level regulation happens rather quickly upon 1 hour treatment of TFP. So we are interesting to know whether this P53 activity regulation is at the protein stability or at the synthesis. So we use the cyclohexamide to halt the protein translation and able to show there's no difference between the vehicle DMSO treated and the TFP treated cells in terms of P53 stability. And on the other hand, if we inhibit the proteasome activity, so we were able to show the TFP treatment actually caused a slower accumulation of P53 in the cells. So basically, these data suggest the Calmodulin regulation of P53 activities at the translational level. So then next we look more closely to exactly how the translation inhibition happened. Basically, we were able to demonstrate the 3' UTRs of P53 is a mediator of this translation inhibition. Together with a RNA affinity purification analysis, basically, I like to focus your attention to this 14 red dots in panel D. Those are the dots represents the ribosome proteins and also translation elongation factors. So we were able to show that upon TFP treatment, these proteins, 9 of those 14 proteins has a weaker association with P53 mRNA. So the next question is whether this inhibition of translation is cell-wide or is gene-specific. So we used polysome profiling to demonstrate this translation inhibition is cell-wide, basically. So you can see from the profiling upon the TFP treatment, all the monosome and polysome fractions are lower than the control treated. And this is further supported by the genes associated with these fractions. So we were showing there are less, in general, genes, including P53, are associated less to these monosome and polysome fractions. So all this data strongly suggest the Calmodulin inhibition of P53 activity is via its translation. So next, we want to evaluate whether TFP has a therapeutic potential. So we examine its ability to improve erythropoiesis in vivo models and also in vitro human cell models. So in the mouse model, so without going through the experimental detail, we were able to show the P53 targeting mRNA expression of P21 was downregulated in the ribosome protein deficient cells upon the treatment of TFP, and also the erythropoiesis efficiency is improved as measured by our red blood cell counts as well as hemoglobin contents. This rescue holds also true in the CD34 positive cell differentiation system as well as in the human. The CD34 positive cells purified the human DBA patient. So the erythropoiesis efficiency was markedly improved in the patient's cells, with CD30 was 71 positive cells almost restored to normal level, and a doubling of glycophorin A positive cells. So these data strongly indicate TFP could be a useful therapeutic compound. So indeed, we actually have a clinical trial going on, so to evaluate the safety profile of a 21-day course of TFP treatment of adult DBA patients who are transfusion dependent. So the trial opened last year, almost over a year ago. So, and with the first patient involved, but enrolled. Then this trial did get affected by this ongoing pandemic, and is reopened this month. And we have a second patient enrolled. We'll start the treatment next week. And the protocol has been accepted also at the Boston Children's Hospital. So we'll have a second site, local second site. So also another note is the TFP is FDA-approved antipsychotic, does have a neurological effect, so marked by hyperactivity. So we are determined to look for better compounds with reduced neurological side effect, and but maintains the ability to rescue hemoglobin level. So using our zebrafish in vivo assay and zebrafish in vivo behavior assay to assess the neurological effect, as well as a human cell differentiation system to evaluate its relevance in the mammalian system. So currently we collect 31 phenothiazines and also synthesize 9 TFP derivatives. We are actively searching for better compounds. So in summary, so the Calmodulin inhibitors rescues the ribosomal protein mutation mediated phenotypes in the zebrafish DBA model. These inhibitors decrease activation of p53 transcriptional targets in both ribosome deficient and irradiated zebrafish, which also translate to human cell models. TFP improved the erythroid defect in multiple DBA models by a different mechanism. Is reduce the irradiation or ribosome stress-induced accumulation of p53 at the translation level. The TFP clinical trial is ongoing. Will include Boston Children's Hospital as a second site. We continue to evaluate the therapeutic benefits of new derivatives of TFP and other phenothiazines using our DBA models. So this is a huge team effort in the close collaboration between the Down Lab, the Daley Lab, and with many collaborators helped with mouse model assay, cell-based assay, and as well as polysome profiling, as well as clinical trials. So, and also thanks to our funding agency. So with that, I would be happy to take any questions.